Commissioner Myjack mentioned. Can you guys still hear me?
Yes, we hear you.
Okay. I keep getting feedback saying they're recording the call or whatever, which is fine, but I didn't know if that was stopping me from being heard.
Good.
So anyway, so EGLE is, this is where we are with this thing. And I will tell you in regards to, first of all, our desire to stop combined sewer overflows, it's not as though we asked the state to come in and do this for us. This is a local initiative driven by the locals. So it has, Chapaton Services, St. Clair Shores, and East Point, both of who've been very supportive of this. The SEMSD, which is Roseville, St. Clair Shores, and East Point, have been supportive of this, even financially. The Board of Commissioners, of course, has been supportive financially. Even the state had given us $3 million in the previous lame duck. And quite frankly, the EGLE staff was all very desirous of this, or at least they were encouraging. Let me put it that way. They were encouraging. The lower level staff that we were initially dealing with, they said this was a great project. This is one of the greenest projects they've ever seen, until it came to the two individuals who've been in charge of CSOs through many administrations. They've been there literally over 3 decades. All of a sudden, for whatever reason, they said they didn't like this project. So we have been dealing with them. We've tried to answer every objection that they've put forward, because this would help us. It's a 2-phase project. This is phase 1 of a 2-phase project that we have. And the phase 1 is to use as storage an existing man-made canal that is only used really for discharge right now of combined sewer overflows. So EGLE has been raising, they said, well, you get this 1,400 foot of waters of the state, and we need to hold on to it for fish habitat and public recreation. I don't know if any of you guys want to go down there and fish in a canal where we're discharging sewage, but maybe. I don't really think so. And then the other part of it is we want to excavate an existing spit of land that's out there to use this for sort of a wetland type of a storage facility, where we are working with landscaping engineers for absorption of the combined sewer overflows before we send it all back down to Detroit for a final treatment. And we would be dewatering this facility, out the spit of land, et cetera, after we build it, after a heavy rain, which most of what this is anyway, about 90% of it is actually stormwater. And then it has some combined sewer in it, and a heavy rain event like what we just experienced the last couple of days. So it's principally stormwater anyway. But even so, we already have 3 million gallons in the canal that EGLE had previously approved. So we said, what's the difference here? They said, well, this is bigger. Well, so if they were concerned about odor in the past, we have never really had that from many of the neighbors there. In fact, Shore Club was giving us an easement to do this because they don't want all these CSOs going past their marina and everything. So they had absolutely zero problem with having this, as EGLE called, open sewage lagoon. Look, do you guys think, honestly, I would be trying to build an open sewage lagoon in St. Clair Shores? Seriously, let's just think about that for a moment. It makes zero sense. There's no way I would be promoting such a thing. So we had an engineering company that is very good. They have an expertise in odor control. They did a big study on this. They found that the potential for any kind of odors, even for a couple of hours or whatever, is extremely, extremely low. And we've also had a public public hearing, and we've talked to all the immediate neighbors there. And, these concerns were raised by some of the neighbors there. There's some very high-end luxury condos in the immediate area. And we were able to talk to them, and they agreed with what we were doing. They've been supportive of the project, again, because we've all just decided, since we've been doing this for decades and having these combined sewer overflows go into the lake, we really shouldn't be doing that. And we've wanted to do this ourselves. And if you think about what EGLE is saying, they're going to deny us the ability to store CSOs and treat it properly, because they say, really, why should you do that when you can do what you're doing right now, which we're permitting you to just dump all that, you can call it as you want to, into the lake. Think about that. That's their position. Don't try to improve it. Just keep doing what you're doing and keep dumping it in the lake. So I really don't think that's the correct answer. I really appreciate Commissioner Haw putting forth this resolution to ask the governor to take a look at this. And obviously, she's got much bigger things on her plate right now. But, we're going to get through this COVID thing, and we're hopeful that she will look at this and review it, and we're hoping for the best. And I do have some information for one of our state reps, but I'll wait until you have any questions on this. And one of the state reps is thinking about doing something legislatively as well. So I guess I'd be open for any questions. And Vince Astorino, our engineer, is on the line also if you have any really technical questions. And Brian Baker, my deputy, is also on for any technical questions or financial questions that you may have.
Sure. So before I open it up, I think Candace, if I had to count the votes, I think all the commissioners here today are going to support this and support what you're doing. My thing is that good enough? Does that have enough teeth with the governor? And we talked before about this. I think you need to have some bipartisan legislation. You get Marino, Churkin, Hertel. You get a couple Democrats, a couple Republicans together. We have a meeting like this in the future, and we get everybody on board and get them to create some legislation. So that's just my opinion, but I'll open it up for questions. Speakers here. Yes, go ahead.
If Kate. I could just speak to that for a moment, Chairman. Kevin Hertel is, as we speak, looking at drafting up some legislation, bipartisan. I mean, really, what could be more bipartisan than clean water? And where it would have Chapaton be sort of a statewide pilot program that hopefully would push EGLE. And, what I told Kevin is, optimally, I'd like EGLE to be involved in the drafting of legislation so we could come up with something that they would feel comfortable with. So we're sort of moving down that path also. So more to come on that.
Wonderful. Okay. So first I have on the list Commissioner Hall. Harold.
Thank you, Chairman. Candace, I do want to say, not only is Hertel looking, he has been talking to Churkin. We have been talking about this most of the morning, waiting for ECHO to come back with their resolution, which you had anticipated for many, many months. This initiative is bipartisan. Macomb County needs to come together as a whole. We talked about the overflow situation over a decade ago when I was chairman of SEMSD, and your initiative, although running 2.5 years is a very long time, just the fact that you've gone out and tried to get the funding and taking it, the state contributing money and then turn around and voting down permits makes absolutely no sense. So it is bipartisan. There are many of the local representatives, and I have talked to SEMSD, and they're going to put a resolution together as well, and we need to expand that scope. Veronica was going to talk to that because we had talked about this being that is part of her drain board activity that we get on a regular basis. So although this is a left hook, it's not a right hook. I talked to the governor's administrative assistant, told him how disappointed personally I was and the members of the commission, and they're going to have quite a few dialogues. I realize it's not the most important issue on the plate right now with COVID-19, but it is an important issue for the Great Lakes, Macomb County, and the future of Macomb County. We can't keep advocating we're the land of lakes and then continually polluting them. So don't give up. I know you won't. You've been fighting this for 2.5 years, you and your staff. We've got a tremendous amount of money invested in this, and the bureaucrats that are making this decision always work for somebody, and that somebody's going to get a lot of attention on this issue. So once again, thank you for what you've done. That's all I have, Chairman.
Thank you. Very well said, Commissioner Hall. Next on the list, Commissioner Kleinfeld.
Veronica always has trouble unmuting.
That's okay. Veronica, are you there? If she's not there, it looks like she might have took herself off the list. So I'll come back to Veronica if she gets it working. So next on the list, I have Commissioner Brown.
Thank you, Mr. Chairman. Thank you, Commissioner Miller, for coming down. What involvement is the Army Corps of Engineers? Have the Army Corps of Engineers cleared this project? Because sometimes they can be a hookup too with some of these lakeshore projects.
I'm going to let Vince Astorino, if you can get yourself unmuted there, Vince, because I know you've been talking to the Army Corps. Where are we with them right now?
So the first stage of this is it has to get through Eagle before Eagle even sends it to the Army Corps. So it never even got to the Army Corps yet.
All right, that's disappointing. I mean, it's amazing how a bureaucracy can be so tone deaf to what's going on here in Lake St. Clair. This is not a new problem. Macomb County's been involved in trying to address water quality issues since the early 90s. We've been a leader in this in every way. And our legislators all know that and have been the conduit of our voice to Lansing. And yet we have an administration that can't get their people to do the right thing, which is embarrassing to everyone involved, regardless of your party. I hope this resolution makes some impact, but it really shouldn't, because they should all be politically smart people and realize that this helps everyone. And to not take action is really kind of it's really hard to understand. So thank you, Commissioner Hall, for putting forward the resolution. Thank you, Commissioner Miller, for the good work your team continues to do with that office. There's so much work to be done, and you've stepped up to the plate and trying to get as much of it done as you possibly can. And the board stands behind you with our pocketbook as well to help you do these things. So thank you, and thank you, Mr. Chairman.
Thank you, Don. Next on the list, we have Commissioner Leon Gillette.
Thank you, Mr. Chair, and thank you, Commissioner Haw, for introducing the resolution, and thank you, Commissioner Miller, for your work on this project. You know, all of us who've been involved in Macomb County public affairs for decades have been frustrated by the progress that's been slow and expensive in dealing with the pollution of Lake St. Clair. And their progress has been made, but it's been enormously expensive. Separation of sewer from public from stormwater. And here we've had a solution developed that could get us exponentially further than we've been able to do at a much lower cost. I think that's extraordinarily frustrating. So I hope this resolution has some weight to it. But Mr. Chair Majek, I wonder if it's possible, if it would be appropriate to invite somebody from the department to come answer commissioners' questions about this. Because I appreciate Candace Miller and her staff being here, and they're always available and always willing to be here. But it's a little bit unfair asking them to represent the position of the department. They can only represent what they've heard or what they've interpreted. Would it be possible to have the department come in and answer some questions?
Talking about
yeah, I mean, is there something we're missing? How can this seem to be such a great project yet be denied?
Well, I mean, I think what we would need to do is wait for ECHL to officially deny the permit, the final decision, and that won't come until they have the public hearings, which means you're talking late June, early July. I think that's a wonderful idea, and also if we have the state reps there as well. But Candace, I'm going to let you respond to Leon's questions there.
I think why not ask them? See if they'll come down. If they want to make a presentation before the Board of Commissioners, we could be there with our PowerPoint, and they could just pick it apart. And you could hear directly from them what their concerns are, and we'd be able to respond. And I guess you could see what you thought of that.
So why don't we try, Crystal, so if you're listening, let's invite ECHL to come. I'm thinking for public services meeting for July, because I think by that time they will have made a decision on this issue. Thank you, Leon.
I appreciate that, Mr. Chair. It's just that I'm a little bit in disbelief that this is going to be rejected given the benefit, the value, and the cost value. So I almost need to hear it directly from their mouths. So thank you.
Great comments there. Commissioner Leonetti, I have you next.
Thank you, Mr. Chair. Can you hear me?
Yes, sir.
Good. All right. Good to hear everybody's voices. Couple questions for Candace, Vince, or Brian. Any one of the three that can answer it. Probably going to be Candace or Brian. I read in the paper that we did have some money that they gave us in form of funding, like a grant for this project, and it sounds like they took it back. Is that correct?
Yes, they. You had one section of EGLE that agreed to give us. Gosh, I forget what it was now, Brian. Was it $2 million? $2 million
Yeah.
of what they call loan forgiveness under
Okay.
the SRF funding that we were going through for this state revolving fund that we had been approved. And a part of the approval of the loan was we were asking for some loan, a portion of it to be forgiven. So it's
Okay.
essentially like a grant, right? So we had about $2 million, and that was the person that told us this is the greenest project they'd ever seen. Then, so we were all very excited about that. And then the next thing, as I say, these two individuals at the top of EGLE that do the CSOs, they've been there for over 30 years. All of a sudden, no, that was one part of the department that didn't know. They weren't sure what they were supposed to be doing, and they didn't know. And we can't give you that money now, or the loan forgiveness. And yes, that's what happened.
All right. So you guys are incredibly great at getting grants and loans. Let's assume the project is green lighted and we can do it. Is it possible that we could get that same type of loan forgiveness program again, or at least apply for it again?
Yeah, we definitely will do that. In fact, one of the things that they have said as an option instead of doing this is we could build another big retention basin, which means you dig a big hole in the ground somewhere and build this retention basin, which we've costed out at about $100 million,
Jesus.
between $90 to $100 million,
Right.
Yeah.
which is probably not realistic, right?
No, and this plan. I'm sorry. Go ahead, Candace.
Well, because they said, well, we could do loan forgiveness on something. I said, okay, if we build that, will you give us loan forgiveness for 70, 80 million? Well, no, but we might be able to give you $1 million or what? We give you something. Well, okay, yeah, all right.
All right. That kind of is a segue to my next question. In the private sector, and I've represented clients that develop like apartment complexes, or they develop some kind of office suite. You run into the Army Corps of Engineers or environmental or whatever, and you always have to give some type of, like, it seems like there's a concession. In order to do this, you have to build these wetlands, or you have to maintain these wetlands in this corner. Is there anything other than this basin that you were talking about that they said you could dig this other pit? Is there any room for some kind of compromise? It seems like they want to retain the water for the fish. Is there something that can be done to reach a compromise on what they're looking for so that we can accomplish our goal? Is that possible? You see that a lot in the private sector. And certainly it costs the project more money usually, but it's a concession. Is there anything like that possible here?
Really, I don't know. What else? One of the other things they keep saying is, well, if you can do, you can absorb a lot of the stormwater by utilizing green infrastructure. In other words, that's like planting trees, right? A lot of trees, a lot of green infrastructure.
Okay.
In order for us to get the kind of planting that we would need to absorb all this stormwater, you'd have to start bulldozing entire neighborhoods in East Point and St. Clair Shores. I mean, think about that.
Yeah.
That's what they're suggesting. I told them that. I said, green infrastructure to get 10 and 15 million gallons every time it rains? I mean, okay. This is not like Detroit where they've already bulldozed entire neighborhoods. We're not in the business of doing that in Macomb County.
No,
but we are going to try to do some green infrastructure, but we could never do what they're suggesting.
Okay. And the last question is the phase 2 with the pipes on the back end, I guess I call it. Have we even applied for that, or do we foresee any problems with that? Is that something that we can even can we start doing that while we're still fighting this out possibly? Or what's your thoughts on that?
Yes, we can. In fact, and Vince might chime in here, but we're under, we're already talking to EGO. We said, listen, we're not going to get too far along here if you're going to deny this. But
Okay.
that's in-system storage, which I really think that they will be favorable toward that. At least they've been encouraging so far. I don't know what to, really, but we are doing that. That will give us, and that would be next year construction. That would give us about 7 million gallons. And we're also doing some work into our wet well, which would give us about another 3 million gallons of storage. So if we do both of those things, we could probably reduce the amount of CSOs that we discharge maybe by 20% or something, not 70%, maybe 25%. I'm not sure. What is it you think, Vince?
I think the latest numbers were high 30, 36, 37% reduction, which is pretty good for 10 million gallons.
It's a third. And,
right.
And would they give us money for that? Would they give us $2 million for phase 2? Would they say, oh, yeah, we can give you $2 million for that?
I don't know. What do you guys think, Brian and Vince?
I mean, it's a good question.
I think
they didn't initially. They only gave it for the retention basin expansion. They did give us extra funding for both projects, but loan forgiveness only for the one, which they've now denied. So we could try for it. We would have to see.
Well, there's no department that I think can do better at it than yours. So I hope you do. Listen, thank you very much for answering the questions, Candace. Thank you for Brian and Vince.
You unmuted yourself.
And thank you for everything you guys are doing. Appreciate it. And Harold, thank you for the resolution and the stuff you're doing. I know behind the scenes with the governor's office. So keep it up. Thank you.
Thanks, Rob. We have Commissioner Duje.
Thank you, Mr. Chair. Good afternoon, one and all. Question. Was there any reason that EGO gave to knock this down, or just this isn't the right project at the right time, or we don't have the money?
Well, the big things have been that, first of all, they talked about the open air sewage lagoon, which we've already went over and refuted that.
Right.
And then the waters of the state with the canal, which I think we've answered that to the very best of our ability. We just are at loggerheads with them.
Okay, anybody there?
I'm still here. Can you hear me?
Yeah, I was hearing an echo. Not sure what.
I was too. Yeah.
All right, all you commissioners here, I see you guys online. So go ahead, Candace. Keep going.
Well, I mean, I've sort of already gone through the reasons that they've said that they're going to deny this, and I don't know. You want me to expand on that?
No,
Commissioner Duje?
Commissioner Majek, Commissioner Duje's, he removed his name, so I think unless he's still on the line or wants to speak up, his question's answered. I know.
Okay, great.
Still on.
So I got on the list here, Veronica, Commissioner Kleinfeld. Are you there?
Can you guys hear me now?
I can hear you loud and clear. Hi, Veronica. See you as well.
Thank you. Okay, so a couple of questions with regard to the resolution. I'd like to put something in there, if we could, before full board about the vote being bipartisan. The votes on the drain boards have been bipartisan. The vote at our meeting was bipartisan. Hello?
We heard you. An echo.
Okay. Also, maybe a mention of the wetlands area, but we need to make it current because they haven't denied it yet. And I was wondering, is it premature to send it to the governor? Should we be sending it to them? And then the last question is, I'd like to send it to the townships and the cities and ask them to consider adopting the same. I would really like to kind of show up with some force on this issue. Thank you.
So Veronica, very, very good comments. So I guess, first of all, we do not have a motion on the floor. And
Mr. Chairman.
Go ahead, Andre.
Thank you. I don't know what happened, but I was taken off and so on and so forth mid-sentence. A couple of other things that I wanted to touch bases on. This doesn't get involved in this plating specialties business out of Oakland County. Is anybody following up on what's going on with that stuff going towards the lake?
Well, my counterpart over there, the Water Resources Commissioner in Oakland County, has told me that they don't pollute. That all their CSOs that they have are permitted by EGLE, which they are, and don't worry about it. So we've been in the rain where their George W. Kuhn facility discharges into Warren, Sterling Heights, runs through Clinton Township, Mount Clemens, and Harrison Township before it gets to the lake. And after a heavy discharge, it is full of wipes, personal wipes. And you know what? They're not coming from the sky. Those are sewer wipes. So that's we've actually had DNA testing done on those, and they're human. But anyway, that's another thing.
Oh, well, I'm very concerned about what's going down. This is going into Bear Creek and so on. And EGLE seemed to be very involved in all that. And I'm just surprised that they're shutting us down on the Chapton business and going out into Lake St. Clair. Chapton was built about 1967, if I'm not mistaken. It's not getting any younger. The pumps were redone probably 10, 12 years ago. But any help that we can get from the state, EGLE and otherwise, in order to alleviate some of this would be very appreciative. So keep up the good work and thank you.
Okay, so commissioners, just give me a second here to speak. So Veronica raised a very good point. Okay, so it has not been, ECHO has not officially denied the permit yet. We're looking that's going to happen in late June, early July. This resolution says, request the governor to intervene and review the denied permit. So I think we have one of two options here. We wait until they deny it and we pass this resolution, or we change some wording there, review the MC, instead of where it says denied, just say review the permit for consideration. So that's what I would kind of recommend. I'm not sure. I'm gonna let the commissioner speak to this. So we either pass it like this after they vote no on us, or we change it around and ask the governor to look at this right now as they're reviewing this permit process. Okay.
Rob,
Chair?
Yeah, go ahead, Veronica. Go ahead.
I'm sorry, this is Harold.
Go ahead, Harold. Let Harold speak.
He's
the motion maker.
I still have the floor. You've taken it away from me twice
All
now.
right. All right, Veronica, go ahead. Veronica, go ahead.
Thank you. I want to hear what Candace has to say about my questions as well. I want to know what her thought process is. Should we go to the governor now? Should we go to EGLE now? I'd like to hear what she has to say. Thank you.
Go ahead, Candace.
Well, the process is they have not officially denied it yet. It would seem to me it would be easier to at least raise your objections. I mean, you can do it more than once, right? It would be better that they don't deny it in the end. I mean, they could still not deny it if we went through the public hearing process. They hear enough people. So I sort of think if you just took the word out deny right now and go ahead and send it up, see if the governor's office will engage. They're well aware. They're well aware if they see that everyone's not rolling over on this. Maybe they'll look at it. I hope that they would, because we really think we have an excellent project here. And if we're not able to do this, the only other real thing that they could do is mandate that sewer separation would happen. Now that to tell you the truth, is optimal. That's an optimal thing. Now, if we've costed that out, that would be about $340 to $350 million, which would, you know, I mean, again, seriously, it's not realistic to do that. So they're never going to do that anyway. And we just thought we came up with a really cost-effective solution to, as Commissioner Drolet said, get us way down the ball field here. Really, I'm you know, I don't know. You can hear the frustration in my voice. I think we've thought this through. We spent $1.5 million already designing this thing and trying to deal with Eggle. And one thing I did say to them, look, if you're going to deny this no matter what we do, why don't you hurry up and deny it so we don't spend another $1.5 million when the answer is going to be no anyway. And so, you know, I don't know. I really don't know. I think if you, I think we can see they're going to deny it. I think we should start saying, you know, speaking to that now.
Very good.
Rob, this is Harold.
Hold on. Veronica still has the floor, Harold. Sorry. Veronica? Okay, so Veronica's done. Okay, so Harold, you are next. And I hope, because this is the second round, I hope now, Harold, we'll get your motion or your resolution settled the way we need it to. Go ahead, Harold.
Thank you. I'm willing to change the verbiage from denial to attention or something to that effect, and ask that we send it to every township and community in Macomb County and have them pass a likewise. I don't like sitting and waiting until they say no.
Okay, so Harold, you just made the motion. Is there support for that?
Yes.
Support, Sauger.
Support, Leonetti.
Okay, hold on a second. Commissioner Keith, can Harold Hall make the motion because he sponsored this bill? Is that the way that works?
Yeah, absolutely, he is. Absolutely has the right to make that motion.
Very good. Thank you. Just wanted to get, so we do have a motion on the floor, moved by Commissioner Hall, and that was supported by who again? I think that was Andre.
You unmuted yourself.
I still had a question there, Rob.
Okay, hold on, Marv. So moved by Hall, supported by Andre, and again, Harold, you want to remove the language where you would say denied, and then instead of reconsideration, consideration. That way, we're making that resolution as is, as they are going through the process. Correct, Harold?
That's correct. And I would also like, as part of the motion, to direct our staff to send it to every municipality, township, and city and ask them to do likewise.
Very good. Okay.
Thank you, Rob.
Thank you. Thank you. Before I move on, I have Leon and Veronica next, but that's the second round. I'm going to allow Commissioner Sauger to speak. I did not see your name on the list on the computer, but I heard your voice. So Marv, please, you have the floor now. Commissioner Sauger, are you there?
You unmuted yourself.
Yeah. Candace, I'd like to know who the people are who turned this down, or are we supposed to know their names who turned this whole thing down?
Their names are Phil and Teresa, and I forget their last names. Vince, what are their names?
Phil Argeroff and Teresa Seidel.
And where are they from?
Oh, I don't know. They work for they've been working for the state on the CSO issue for like 30-some years.
Are these appointed by the governor? Are these appointed by the governor or who?
No, they're not direct appointees. I don't believe. They're just, they're civil servants. They've been there through all these decades. So Republican governors and Democrat governors.
Well, it seems to me somebody's got to be their boss that we can get to, because if they're holding up this whole project because of maybe their personal vendetta or whatever they have, we should know that.
Well, I've suggested that. I have talked directly to Liesl Clark, who is the director of Eggle, and This is what we got.
Okay, I didn't get very far. I know you're doing your best, but it seems like somebody's got power over them. But thank you anyway. And
The power would be with the director of EGLE, who is Liesl Clark, who is the direct appointee of Governor Whitmer.
Okay, is that it, Marv?
You unmuted yourself.
I muted myself. Okay.
All set. Okay. Is there anybody else on the first round? Okay, seeing none on the second round, I have Commissioner Drollet.
Mr. Chair, I can't remember if I muted myself or not. Can you hear me?
I can hear you now.
Okay, thank you. With respect to the process, it might be cleaner if we simply passed this resolution as it's worded today, and then asked Commissioner Haw to work with staff between now and full board to get the wording precisely as he thinks would be appropriate based on the input he's gotten here. I'm a little bit concerned about just trying to make changes on the fly. I think we can just move it to full board with the knowledge that Commissioner Haw will be working on the language to, I guess you could say, adjust for the conversation that we've had with Commissioner, with the rest of the commissioners and with Candace.
That sounds like a great idea. The thing that I said that I thought could work is just strike the word denied, and then the other word where it says reconsideration, just have that consideration. But let me just stop there because Harold made the motion. I'm going to give the floor to Harold for you to comment on what Leon said. Harold, go ahead.
I'd be happy to do that, Chairman.
Okay.
I always like to have Leon read the words precisely.
Okay, so what we're talking about right now is we're going to pass this resolution as is, when it still says denied, and we're going to work on that between now and the full board, which is tomorrow, to get the appropriate wording. Is that correct, everybody?
It's correct by me.
Sounds like correct here. Okay, all right. Sounds
Makes sense.
very good. I have now on the second round Commissioner Kleinfeld. Veronica, are you there?
Yes, thank you. You
Wonderful.
hear me?
I can hear you.
Okay. Actually, the first thing is what Leon said is exactly what I was going to suggest because the whole thing is written in past tense.
Right.
So I was, as I was going through it, I was going to specifically ask, could we have it reworded? And I'd also like the opportunity to talk to Harold between now and tomorrow with regard to putting something in about it being bipartisan or maybe mentioning the wetlands, and it'll be up to him whether or not he wants to incorporate it. That's all I have. Thank you.
I think that's an excellent idea. Okay, any other questions or comments, commissioners? I see no one left to speak. So we do have a motion on the floor. Please vote.
That motion passes 13-0.
Wonderful. Candace, Brian, Vince, thank you very much.
Thank you, all of you, commissioners. We really, really appreciate it. Thanks, Commissioner Haw, for sponsoring it, and thank you so much, Chairman Myjack, for putting it on the agenda and moving me up. I really appreciate it all.
Great.
Thank you.
Be safe and healthy. Thank you. Okay, Commissioner, next on the agenda, public service.
Mr. Chair, I move B through I in their entirety.
Wonderful. So we have a motion. Is there
support Carabelli?
Support, move. You guys are too fast for me. Moved by Drollet, supported by Carabelli. Any objection to that? Seeing none, please vote. Okay, just popped up. Please vote.
That motion passes 13-0.
Thank you, Mike. I need a receive and file motion for the public services correspondence A through D.
So moved.
Moved by Carabelli, supported by
Drollet.
Drollet, please vote. Okay, wonderful. That will conclude the Public Services Committee. We're going to start now with Health and Human Services Committee. The first is presentations by Kevin Evans, the director of Martha T. Berry, his monthly report.
Thank you, commissioners, for this time, and Chairman Majak for your generosity. I'm grateful to you and your, thank you. Just a few minute update. Before I talk about specifically how well your county medical care facility performed during this COVID crisis, I thought I'd share just about 2 minutes that may help you in your various areas to understand just the difficulties that skilled facilities had all over the county in dealing with the COVID crisis. First, we learned about the potential threat in late February, and in early March, the CDC sent out guidance that essentially put nursing facilities 6th in a priority of 11, and you had to have had contact with somebody from China or Europe. They changed that a couple days later and said you had to have symptoms. But we found out later, of course, that you could be asymptomatic for several days and put people at risk. We had most of the PPE, personal protective equipment, that came in the area was shipped to hospitals and then first responders. We were compelled by the Region 2 North to have all of our residents and the responsible parties reconsider going to the hospital. That was one of the biggest challenges that we had, in that the hospitals were telling us they could not guarantee care or prioritization during the surge of COVID-19. So they asked us to, every facility in the area, to talk to responsible parties and ask them to change their heroic measures to do not resuscitate or do not hospitalize. Region 2 North actually was the federally funded program to coordinate services, and they were supposed to have a stockpile, had absolutely no stockpile of PPE to help. Since the beginning of this, we've received over 200 rules changes, some as little as a page or two, but most of them between 2 and 14 pages. I'm sorry, not just rules changes, but guidances, toolkits, orders, clarifications. The largest one being 272 pages, all of which we had to read, internalize, operationalize, and communicate to our staff. Many times the guidance was changed within 2 or 3 days, and we'd already been in the process of enacting something that went for immediate implementation that we had to change. So these are just some of the struggles that the facilities all over the area had. As far as test kits go, early on there was, I'm sure you're well aware that there were very few test kits available. And I think that was one of the challenges that we had early on, is that we were often denied test kits just because there weren't any. The test kit process took as much as 3 days to get one, and then another 3 to as many as 22 days early on to get the results back. So those are just some of the challenges that each of the skilled facilities in the county had to try and overcome what really was something that that this county in the Southeast Michigan had in a way that was worse than many countries around the world had in this COVID crisis. As far as Martha T. Berry goes, I am just so proud of the team and what we had done. Last week, the state survey teams came in to do a specific infection control survey. And they asked us, they were very respectful and asked us how we got ahead of the virus. I'm proud to say that, because they've seen so many things. And when they came into our facility, I know they expected much worse, because much worse has happened. That isn't to say that we haven't lost people. I regret to say that that we've had 20 that passed due to the COVID crisis.
You had 20 in your hospital?
20 of them, yes. 14 passed away in our hospital, and 6 in our facility and 6 in the hospital. We did have 194 tests negative, which a lot of people don't talk about. We had 46 total tested positive out of the 200 that we had. We have had actually, let me take a look at the number real quick just to make sure I have it right for you. Their definition of who's recovered is they have to be without symptoms for 30 days from diagnosis. And we've had 16 people recover from COVID-19. And we've had 20 of our COVID residents discharged from isolation, and that have been, they're going to be close to being recovered. They've been already 3 weeks out. So we've had a tremendous success. We did have to make some decisions actually that were counter to regulation. And I'll just give you a couple of examples. They did not, the fire marshal rules say that you can't put plastic up for isolation. And we thought it made sense that we cohorted immediately anybody that had any symptoms on that, because we weren't getting test kits. We said, let's get everybody in isolation that has symptoms. And we put, as all the PPE that we had in that area, we focused in that area and had consistent assignment. We had many of our sister facilities, the fire marshals, when they called, said, no, don't do that. But we did it. And it was about 2 weeks ago that they sent a clarification out that said it was okay to put that plastic up for additional isolation. So I'm pleased that some of the decisions we made on erring on the side of the care actually were vetted out as the process went. There were a number of other things that just didn't, the regulations between organizations and clarifications, they weren't clear, and we had to make decisions. So most recently, our facility had put everybody in isolation because we had another outbreak that we knew came from community with one of our staff members. So we isolated everybody. We essentially made 8 small nursing homes in our facility. I'm pleased that was successful. But I will tell you that it's taken its toll on staff. They have lost brothers, moms and dads and uncles, as well as the knowledge of knowing that they may have been the one that not knowingly came into the facility, had COVID and shed it before they actually were aware that they had this.
They lost family members, and they believe the staff family members died of COVID, and the staff thinks they got that from Martha T. Berry.
It goes both ways, Commissioner, Mr. Chair. Just to think about, when you're in a war zone, there's all sorts of fear that happens, and whether it's true or not, the reality is it's a fear. And we don't have the contact tracing that we'd like to have, and we don't know how it happens if they brought it in from a family member, right, or if they brought it to a family member. So that fear is every day as they come in direct contact, providing care for people that they know are COVID positive. So our team, I have to tell you, when they're now doing. Going to be putting a commission together investigating nursing homes as to their response. I can tell you, and I hope you hear just in this synopsis, that we were really not set up to succeed early on. But I'm not blaming people. I just want you to know that too. It's important that you hear me on that. Yeah. Every department did what they thought was best to try and get information to us. And it overwhelmed so many people because we were trying to figure out what's the right thing to do based on what the CDC and the CMS and HHS and the governor and the president and OSHA are all sending stuff to us saying, this is what you have to do. The multitude of webinars that we had to go to and Zoom meetings that we had and discussions on to try and how to get this right. Our staff, there are some facilities, I'm sure you've read the stories where the staff just went away. Ours didn't. We had a little fear early on, where we had a couple of days of crisis, but when we communicated what we were going to be doing and how we needed their help, they were heroes. So our turnover actually went down in April, which is counterintuitive to what was happening here. They just said, we need to be here. So we had one dear lady lost her dad due to a heart attack. 2 weeks later, lost her mom due to COVID, and came back to work 2 days later. I said, "What are you doing?" She said, "They need me." So I'm here today to tell you that I'm just absolutely proud to work at Martha T. Berry, that the people that work there are amazing. And through the difficult time, they have just really shown that they care about people, and they put themselves in harm's way.
Absolutely.
And I'm just grateful for them.
Well, Kevin, I know our whole board and the county and the residents of the county thank you and thank the staff for the heroic work they do. These are very difficult times. There's no question about that. And we just want to, we want to make sure that they're safe. Everybody's safe, So I have first on the list, Chairman Bob Smith.
Hi, Rob. Can you hear me?
I can hear you, Bob. Go ahead.
Okay, thank you. Hi, Kevin. Appreciate you giving the report, and I appreciate everything you've done for the patients and trying to keep them safe. And I'm just not sure. I just want to make sure that the board and everybody listening understands that, nursing homes across the state were pretty much forced to take COVID, 19 patients. And I know originally you were trying your best to keep your residents that were already in-house safe. And I appreciate you trying to do that. I know that it's not a good situation, intermixing, COVID positive patients with elderly patients in a nursing home. Can you tell me, Kevin, how many people had tested positive for the COVID-19 before you started having to take people from the outside?
Well, our first round, again, it's difficult to say because we had so many limited tests. I mean, I feel badly for the health department because they were the only source that we had, and they weren't getting enough. So, for example, we would ask for 10 kits, and they said, "We've got 3 to give you," and then we have 5 to give you. So they were struggling to get it early on, but we only had 1 for a long time. And then we had a resident come back from a non-COVID related issue, came back from the hospital and had to turn around right away because they had developed symptoms. But they were in our building, I think 36 hours or so. And that was the first run that we had. It happened so quickly. We had 6 people that had COVID. We immediately got them to isolation. And so we had 1 for a while, and then we went from 1 to 7, and then we had a couple of more stragglers, and then we had another hit from one of our staff members that wasn't aware that they had it, and people were getting sick all around them, and then they got ill after and found out that they were the cause of it. So, yeah.
Well, again, Kevin, just wanted to point out how appreciative I am and the whole board is of your work there and what you do to try to provide the best service for the patients there and protect them in a situation like this. So thanks again for all of that.
Thank you.
Thank you, Chair Smith. I don't have any other speakers, or is there anyone else who has any questions or comments for Kevin? Okay, seeing none, can I please get a receive and file motion? Oh, Commissioner Hall, you just...
Thank you, Chair. I was a little late on hitting the button.
All right.
I just want to mention to Kevin, I have 2 friends of the family that are both in Martha T. Berry, and the way they are being treated and respected over there is a tremendous tribute to you and your staff. They couldn't find a place to put an 88-year-old mother. I recommended Martha T. Berry, and they have come back and actually baked me peanut butter cookies which I'll share with you someday, for recommending the place. So great job to you.
Thank you. Thank you very much. I would add one more thing. We talked about the delay in some of the testing early on. I've been working with Director Bill Rodella, and pleased to say that we have gotten all of our residents tested, and this week we received all of our test kits to be able to test all of our staff members. And we've already tested 130 just in one day of opening up our clinic for our team. So we're headed in the right direction there as well.
Okay, wonderful. Any other speakers for Kevin? Seeing none, can I please get a motion to receive and file?
So moved, Carabelli.
Moved by Carabelli, supported by?
Lucido.
Supported
by Lucido.
Thanks, Liz. We have a motion to receive and file. Please vote.
That motion passes 13-0.
Wonderful. Thanks a lot, Kevin, for coming by, and give our regards to the staff. Tell them we thank them for all the wonderful work they do.
Thank you, Mr. Chair. Thank you, commissioners, and stay safe.
You too. Okay, commissioners, we're going to go on to item 8, which is Health and Human Services Department recommendations. I have items A through D. Do we want to take them individually one at a time, or do we want to make a motion for all of them?
You unmuted yourself.
I'll make a motion to approve all 4.
Okay, so moved by Jay, supported by who? Is there support? Okay, supported by
Romano.
Okay, so we have support by Are there questions or comments on any of these items?
I have a question, Mr. Chair.
Go ahead, Commissioner.
Naturally, he has a question.
I'm not sure if you recognize. There's so many echoes.
Yeah, I'm hearing you guys. Please do me a favor, commissioners. When you're not talking, please mute yourself. Okay. I can't remember who was speaking there. Romano, did you want? Please, if you guys want to speak, either. Okay, I see the list here. I have Brown, Drolette, and Bob Smith. So, if you want to speak, go on the speakers list. Okay. So we're going to start first with Commissioner Brown.
Thank you, Mr. Chairman. I've got a question about item B, the medical marijuana education video. So before we vote on them all, I'd either separate that one or we can answer the question now.
And I can't find that on here. Oh, wait, let's see here. Oh, on item B, you want to separate that one?
I want to ask a question about it before we voted. That's all.
Okay. Well, let's go ahead and just. Any other questions on any other items, commissioners? Because if none, we can go ahead and talk about item B. The questions for Don. Okay, so let's take item B, the marijuana awareness education campaign. Don, you have the floor. Ask the questions you want, please.
First question is, how many bids were sent out for this expenditure? $85,000 is a lot of money. Who's there? Someone from the department that can speak to it?
I think we have Bill Rodella here. Bill, are you here?
Yes, Rob, can you hear me?
Speak to that. Yes, we hear you. We see you. Welcome, Bill. Hope you're doing well.
Thank you. Thank you very much. This is the same company that we have worked with on the previous year's campaign using these funds from the state. We get these dollars from LARA, Licensing and Regulatory Agency. They really have the locations and the ability to get these up quickly for the rest of the year. There's only, from my knowledge, 2 companies that do the outdoor ads. And this particular company has the majority ones in the locations that we desire. Plus, they have the only contract with the buses that we do the advertising on too. So you have to work with outdoor to do the bus ads.
Okay, thank you, Bill. I appreciate that. And thank you, Mr. Chairman. That's all the questions I have. I'll support the motion.
Thank you. Does anyone else have a question for Bill on item B? I don't see anybody on the speaker list. Okay, does anybody have any other questions on any of the items that we are going to vote on, which would be...
Mr. Chair, I'm sorry. I put my name on the list to ask a question on item B, but I may have messed up.
Go ahead, Leon. You got this. You got the floor. Go ahead.
Thank you. I guess it's to Mr. Bell as well. This is money that we get in as far as a grant, correct, Bill?
Yes.
Okay, is there any way we could potentially, I mean, do we have to spend it on this? Could we spend it on something useful, or do we have to waste it on the billboards? Is there any option?
This is, these were funds that were designed to support communications, outreach, and education as a percentage of the medical marijuana program that started about 5 or 6 years ago. So this is the second year we've received grant dollars, and it's based on how many medical marijuana cards a particular community has.
I'm sorry, those aren't my questions. My question was, is there a particular way we have to spend? Do we have to spend on these billboards? Is there a
We got
potentially?
3 options. We got to do communications, outreach, and education. And we get, and so this is just one component of what we're spending the money on. That's what we see done in a lot of other communities. So this is a statewide initiative, and other communities are doing advertising on billboards and buses. It provides phone numbers for people and a website for people to find out more information. And it's hitting some of our targeted, the messages we're putting out there are, I think, very good in letting people know, don't drive while using medical marijuana. If you're breastfeeding, don't use medical marijuana. There are messages that these billboards have. And again, it's just one of the means of doing that communications that we have to do through this grant.
Thank you. I just appreciate the answer. Thank you, Mr. Chair.
Thank you. I have on the list next Chairman Bob Smith. Did you want to speak, Bob? Okay. Chair Smith, did you want to speak? I have you on the list to speak. Okay, I'm not hearing him, so I'm assuming. Bob, you got to unmute yourself. Go *6 because we can't hear you. Okay, is there anyone else?
Hey, Rob.
Yes. Okay,
Hey,
I got
Rob.
it. Okay, yep, we got you.
Actually lost you guys for a second.
No problem.
Yeah, I'll pull my name off, Rob. I'm sorry. I don't need to speak on this if that's what you're asking.
All right, so I have no other speakers on the list for these recommendations. We're going to vote on A through D. We do have a motion. Please vote.
Oh.
Thanks a lot for coming here today, Bill. Be safe and healthy.
Okay, thank you. Thanks for your approval.
That motion passes 12-0.
Great. Thank you, Mike. Next, we have the Health and Human Service correspondent. We need to
move A through E in their entirety, please.
Moved by Gillette, supported by?
Support. Muted yourself.
Supported by Duke.
Yes.
Very good. Please vote. I believe that passed. Item number 10, new business. Any new business, commissioners?
You unmuted yourself.
Sauger.
Go ahead, Marv.
Yeah, I'm still baffled over this 2 people who voted no on the project, and who they are, and somebody's got to be able to sit down with them, or if we can we call them into our office or their company into our office, because they're holding up a big project, and it's just because of 2 people who I never heard of in my life, and I don't think anybody else has. And so far, I've got no support on this board from you or anyone. Now, let's do something about it. But all I hear is, yeah, it's 2 people, and they gave the names, and even Candace is upset over it. But what can we do about it? I wish somebody would look into it. Thank you.
Thank you, Marv. Any other?
Hey, Rob.
Yes, sir. Go ahead, Chair.
Bob Smith, thanks. So, 2 things. I'm going to speak to D now. I didn't need to speak to it during the meeting. The animal control grant was just on there because we invited Chief Randazzo to come and speak about it, just as a good news kind of thing. They applied for a grant. They received a grant. and they were going to give people who had taken animals and pets from the shelter to house during this pandemic. They have money now to give to some of these people to help, cover the costs of caring for those animals. So he put this in, we passed it through. We didn't even really, we had to just do a quick bypass on it because I think it was 10,000. So he didn't have to come and speak on it and request the board, but we asked him to come in. That's why we put it on the agenda. And just Marv, if you're listening on another note, they didn't vote no yet. And we are looking at trying to get them in to talk to us and doing a resolution about it. So just so you know, there are people all on this board and other places trying to do something about this with these two people that apparently may or may not vote for the project that Candace Miller is pushing. So just so you know, everybody is on top of it. And that's it. So I just wanted to let you know that.
Okay, Bob, good job, because I've heard nothing about it, and I think it's interesting. We should have somebody talk to these two people. Thank you. Good job.
Thank you. Any other commissioners under new business? Anybody
Yes.
else? Okay, go ahead.
Yesterday it was reported, it was announced that the federal government is sending many millions of dollars to Macomb County in part of the COVID relief. And the county executive and the Department of Emergency Management will be the ones that will be passing through that money to the appropriate parties for reimbursements and so forth. And that's perfectly appropriate because under the order that we granted the emergency powers to the executive, he has the ability to go forward and pass that money through. Well, I would like us to look at the resolution that we passed, 4633, that talked about reporting. And I'm sure Vicky's good about that, but we can just touch base for a reminder that we'd like an accounting of what the money is going to, or who it's going to and what it's going for, in terms of listing of, say like Mike, Bills or Romeo for PPE equipment, let's say, or whatever it happens to be reimbursement for Macomb County for overtime hours. So we have an accounting of the money that's being passed through. There's a lot of money going to be coming through and passing through the county on the way to the local communities. I would like to see an accounting of how that money is being spent and where it's being sent to. Not that we need to approve it, because we've granted the executive the authority to do that, and I'm comfortable with that. But I still would like to see where that money is being spent, and sent to. So the staff could pass that along and really look at the resolution, because we did particularly put some requirements in there as a result of us suspending the order that called for that type of information. And I don't remember the exact verbiage. Tried to get it before the meeting. I didn't have enough time to pull it all together. So just for FYI for everyone's purposes, and just so we can all be transparent. Thank you.
Very good suggestion, Don. Very good. Any other commissioners wish to speak under new business? Okay, at last and final time, any commissioners under new business? Okay, seeing none, we'll close that portion of the agenda. Go on to item 11, public participation. Is there anyone there on the public who wish to speak, who are either on phone or via computer? Anyone from the public? You have to press *6 to unmute yourself on your phone. I'll ask the final and third time. Is there anyone there from the public?
You unmuted yourself.
Motion to adjourn.
Okay, moved by Ducey, supported by
Sauger. Okay.
Please vote to adjourn.
Joel, votes aye to adjourn.
Okay. Well, everybody have a wonderful evening. We do have full board tomorrow at 3. Be safe and healthy. Thank you.
Good job, Mr. Chair. Take care. I'll talk to you soon.
Have a good day. Have a good evening, everybody.